Hi, I'm Mike Bishop, your United States Congressman, and I represent the families of Michigan's 8th District in Congress. I serve in the House Ways and Means Committee. As you know, Republicans have officially taken the first step in addressing America's health care crisis. Obamacare is not sustainable, and because of the way it was crafted, there are no quick fixes. It must be repealed and replaced, and done so as close together as possible. Every day since I have entered this office, I've heard from families, seniors, small businesses, medical professionals, and so many others about the struggles they've faced and continue to face because of Obamacare. There are so many testimonials that tell the story, but I'd like to share a few. Take Kristen, for example. She's from Holly, Michigan. She saw her share of her middle-income family's health care plan increase by 18% in 2017, and the out-of-pocket cost for her premiums rose over $1,500. Kristen said the raise she and her husband received on a yearly basis couldn't even touch the cost of the premium increase, let alone the deductibles, the office visits, the over-counter drugs, the prescription drugs, and so on and so forth that we all know about. Or there's Denise and her husband from Clarkston, Michigan. They live on a fixed income. They were forced out of their job, leaving them unemployed at age 57. Since the implementation of Obamacare, Denise saw her family's monthly premium increase from $500 to over $2,000 per month. Just think about that. If you're living on a fixed income and you have that kind of cost increase, it's completely impossible to absorb, and it's catastrophic for that family. It's tough enough to face the loss of your job, but to see the mounting cost of your health care skyrocket beyond your control, it will leave your family helpless, and it's agonizing. That's not how health care should be. I hope we can all agree upon that. Every member of Congress has constituents who have been adversely affected by the failing health care law in our nation. What we do know is doing nothing is not an option. That's where the American Health Care Act comes in. As a member of the House Ways and Means Committee, who has jurisdiction over this bill, we are focused on dismantling Obamacare's burdensome mandates and taxes, including more than $1 trillion in taxes that have crushed the American people and broken the backs of our small businesses, the very engine of our job providers in this country. We want to make sure families and individuals can afford health care that fits their needs, regardless of their income. We will do so by enhancing and expanding health savings accounts, as well as providing a monthly refundable tax credit to low and middle income families. People should be able to access the coverage they want and need in an open market that promotes quality and choice, without the government telling them what policy is best for them. What's more, the American Health Care Act returns power to the states. It modernizes Medicaid, giving the states, not Washington, D.C., the tools and flexibility they need to best serve local residents for generations to come. In fact, this is the first Medicaid entitlement reform in 52 years of its history. We must make fiscally responsible decisions to preserve and strengthen the programs millions of Americans rely on for a better life. Job-based coverage will also be preserved. Patients with pre-existing conditions will continue to have important protections, and children up until the age of 26 will be able to stay on their parents' plans. There are so many other conservative issues and reforms to come, and they will come in future bills. This is the first step in the direction to reforming and restoring American medical health care. This is our opportunity to make our nation's health care law work for more Americans. To address your concern, there will be full vetting of this new legislation and an open dialogue throughout the entire review process. I can assure you that everyone will know what is included before it moves onto the House floor, which is far different than what we've seen in previous iterations of healthcare reform. In fact, I was just in the Ways and Means Committee last night, this morning, addressing this issue where there was a full and open debate on both sides, Republicans and Democrats, sharing the same stories that I shared with you and much more, giving a full review of their perspective of what needs to be done in healthcare. And that kind of information, that kind of input is imperative to crafting the best possible public policy going forward. In the meantime, it is irresponsible to threaten others with fear. Fear tactics are used for those who are trying to derail this reform process. and it just has no place when it comes to health care for you and your family. We will not pull the rug out from under people. There will also be a transition period so that people can become accustomed to what we're doing, 2 or 3 years, so no one will be left behind. Our plan means more Americans will have access to better, more affordable health care that works for them. In today's world, anything else is unacceptable. I encourage and welcome your input, and I hope to work together on this issue. Healthcare is humanizing. It's humanizing to all of us. It has a deep importance for every single American, and it really has nothing to do with political affiliation. Believe me, I understand that. I've heard from you. Just like many of you, my family and I are also on the exchange. All of Congress is. We have heard from you. We want to hear more. So whether you are for or against Obamacare's repeal and replacement, this is what the American people have asked for. Too many of our neighbors are suffering under a law that is collapsing under its own weight. I'm very proud to support the American Health Care Act, which is just the first step toward real health care reform. So I look forward to hearing from you. I look forward to hearing from our district and our state as we move forward. I've been working with you on a daily basis, meeting with you directly. I will be on listening sessions in the future going forward so that we can hear more from you. I've been connecting with you at teletown hall meetings. Our office is very busy in responding to your inquiries, hundreds and thousands of emails, letters, calls. We'll continue to respond and answer your questions. Do not hesitate to call us. If you'd like to contact me directly, please visit our website, www.mikebishop.house.gov. Thank you for tuning in and have a great day.